as we look at the book, and for those of our listeners who have not seen the book or have not purchased it yet, again, I would highly, highly recommend it. It's very well written, both from a statistical standpoint, an experiential standpoint. What is the biggest takeaway that you want people to get from this book?
So I think what's really important in our country, we have healthcare worker advocates, like nursing home advocates, and we have consumer advocates, and they don't really get along and talk to each other. And like, I really want to see us bridge the gap and work together in creating a healthcare setting that is advocating not only for our healthcare workers and our residents and family, both of them, right? And I think what I really, really want people to understand is your loved one cannot, will not get good care unless we are dedicating our time and attention and resources to our healthcare workers and to our frontline staff. We must invest in that staff in order for you to get your loved ones to get good care. It can't happen otherwise. And I really talk about the burnout in the book, and I talk about how the staff want to do a good job, but the demands, the physical demands, it's almost impossible. And so we really need to invest in this workforce, all, housekeepers, the CNAs, the nurses, everybody, in order to ultimately deliver the high quality of care that this vulnerable population 100% deserves.
Yeah, great, great takeaway.